Good afternoon, everyone. I'm going to be talking about a topic that is very near and dear to my heart, and this is a topic that many residents want to know about, and many post graduates also want to know about. So, before we go ahead, I would just like to say sit back, relax, and enjoy the slides and the journey. I will mail you this PPT at the end. You can see my email ID, just shoot me an email, and I will send this to you. No need to take notes or anything. Okay, just a few days ago, my seniors had graduated from their MD exam, and I happened to ask one of my dear seniors, "Would you do a fellowship after your residency?" She said, "Well, I want to do a fellowship, but it's too expensive. There are very, very few seats available, and is there really any added benefit of doing a fellowship?" So I always wanted to do a fellowship right from the very beginning of my MD days. So I went ahead and I developed this questionnaire, which I disseminated among like-minded and unlike-minded residents. And we got a tremendous response, around 54 responses. We tried to identify the pain points that residents face with this fellowship. And this is similar to this leadership journey. These are basically the puzzles that were devised by Zen masters. And we were exposed to these during our wonderful leadership pipeline session, which Rashmi ma'am had started. So basically, you can see in this is actually the first stage of a person. And this can also be correlated with fellowship. You can see that he is looking to the tall grass, trying to find the ox, but he cannot find. He is searching aimlessly everywhere. And this would be your first stage in a fellowship journey. I personally thought that I would take dermatology because it's an end branch, and investing more time, more money, and especially when I have a lot of responsibilities and there are very, very few seats, seems like a difficult thing. And here you are really not interested, or you are looking around everywhere and are exhausted. Well, in the next stage, you happen to see the footprints of the ox, or you have an idea of that you want to do a fellowship. Now, in this stage, the questions that come to your mind is you don't know how to do a fellowship, you don't know how long it's going to take you, and there are so many subjects available and so many people offering fellowships that you don't know which one is genuine and which one is fake. In fact, few people offer you money to do their fellowship, whereas others actually ask you to pay a huge sum to do them. So which is real? Now, the next stage, you side catch of the ox, or you know which fellowship you want to do, and you know which course you exactly want to enroll in, but you do not want know how to get into that. Now, this stage is the stage number 3, and your mentor or someone who has done a fellowship can help you a lot in this. So I'm mainly going to be focusing on people in these 3 stages of journey. However, this may be applicable for any of you. So if you look at the current curriculum of the postgraduate, you see that we do a lot in a period of 2 to 3 years. However, this lot is able to meet the demands of only this around 50%. But you would be meeting the demands of majority of the patients, but still there is a huge unmet need. And let me ask you this: if you don't match this unmet need, who do you think is going to match it? The patients that you are supposed to be treating are going to be going to unqualified professionals to get them done. So this is the actual demand. Whether you like it or not, there must be people who are capable of doing it, qualified people who are capable of doing it. So it's also your duty. Now, you may ask me, is this the same whether I'm going to be doing private practice or if I'm going into academics? Well, I'll take the private practice first because it's easier. Let me ask you a question. If you have a skin problem, would you go to a general MBBS doctor or would you go to a dermatologist? Yeah, you would go to a dermatologist. Now, if you had a skin cancer and there is a person who has done a fellowship in Mohs micrographic surgery versus a general dermatologist, who would you go to? Yeah, I rest my case here. So again, coming to academics. So if I'm going to stick with academics, is there any purpose of doing a fellowship? Well, you see this, they conducted a study and they found that people who did a fellowship were more likely to be cited. Now, this is because they are focused on a particular niche, and whatever they publish, they are doing in their area of interest. And when you do something in your area of interest, you produce good work that is likely to be cited. And here again, I've shown 2 pictures of the Zen puzzle. Basically, in this is the stage wherein your work speaks for itself. Your work goes out in the world, and even when you are at rest, people are talking about you, and your work is gaining popularity. So even when you're at rest, you're helping mankind progress. So one thing that is common to all is this. I just discovered yesterday night on one of ma'am's IIDWell EC, leadership international talks. So doing a fellowship would also help you to become a key opinion leader. Key opinion leader is basically that stage where your opinion or decisions or your whatever choices that you make is going to have an impact on a lot of people. Well, this is much more easier when you're more qualified and have done a certain amount of work in that particular area. So hopefully I have helped you go from stage 1 into stage 2. Now, are all three the same? Well, no, they are not the same. So you can consider it analogous to basically this elephant army, the cavalry and the infantry. Well, each has their own advantage. At the same time, while doing a fellowship may seem great, it is much more difficult getting into them, and you need to invest a lot of time and money. So that being said, I come back to this Zen person thing. So just because the opportunities are there are a number of low-hanging fruits that you can easily take that would be more practical in your situation. Don't let your passion take you into a place where it burns you. When there are easy options that are just as good and within your reach, you should actually aim for them. And hopefully by the end of this, you would be able to identify them. So how to choose your choice of fellowship? There are a number of options available. This was just this morning. When I was having my breakfast, I took that salad with that tongue, basically, and people commented, how come you're holding it funny? Why are you holding it with your thumb finger and your ring finger? I said, it just feels right because I'm used to holding a needle holder and just it feels magical when I hold it like that. And I wouldn't hold it in any other way. Also, I enjoy treating patients who are of the teenage and adolescent age and who have acne and melasma. I don't think that acne and melasma is a small issue. So you see what your interests are and let that guide you in your choice of fellowship. Again, for there are also people who have published a number of things, and there are these IIDVL magazines. I would suggest you grab one of these and see what are the developments that are happening in each. And if it piques your interest, maybe you want to pursue something further in that. Also, a shorter method would be to, at the end of an exhausting day, take your Rook's textbook of dermatology and open the index. So which of these, just ask yourself, which chapter would you dare read at the end of a tiring day? Also, a similar thing is if you were in an OPD which was just about to end and patients and your colleagues are all leaving, and one of these patients were to walk in your OPD, which one of these patients would you rather have it be? So, and once you decide that you want to do a fellowship in a particular subject, the question comes, should you do it in India or abroad? Well, doing abroad obviously has its certain advantage. You get exposed to a different work culture, the latest technologies, and the etiquette itself is different. However, you must balance your current qualifications, your lifestyle, and the amount of money that you have. So when I asked people, which country would you do your fellowship in? I received an option called first world countries. So I went and Googled what is actually a first world country. Well, these were actually divided based on the World War, and first world countries include countries like the USA, Canada, Australia, and the United Kingdom. So these are really popular. However, it does not mean that the fellowships in other countries are any inferior. So let's go into getting a fellowship into America. Well, traditionally people think that fellowship includes only dermatopathology, dermatosurgery, cosmetic, pediatric, and most micrographic surgery. Well, these are the traditional fellowships that are offered. However, there are a number of non-traditional fellowships also offered, such as the contact dermatitis and the teledermatology and cutaneous oncology fellowships. The thing is, to get into one of these traditional fellowships, it's very difficult in the United States. You need to pass the USMLE, get an ECFMG certification. You need to do your residency over there, and then you need to be matched. So, but the advantage is once you do a fellowship through this, you will get accreditation with the ACGME, and you can practice over there in the United States. However, again, it's a very difficult journey, and it's much more easier doing a non-traditional fellowship. To do these non-traditional fellowships, you must actually write to the director of the program. And there are a number of universities which offer these fellowships. You can see this list right here. And just a word of advice, you can check each of their websites and they provide a director whom you can contact regarding doing these fellowships. And just again, keeping with the current scenario, the COVID might have affected few of these fellowships. So just be doubly sure before you go to that country and you find out that it's suspended. Coming to the United Kingdom. Now, the United Kingdom is too similar to the United States. They offer 1-year fellowships, but again, these are offered to those who have completed their certification of completion training. That means that you must have completed your training over there in UK, and you must have passed the MRCP exam. Now, this again is quite difficult, and it's like touching your nose like this around your head. So there are easier options available, which are short-term observerships, which range from 1 week to 3-month course, and there are offered in a variety of subjects. However, the only drawback is they cost around £700 per week. So if you have the money for it, go for it. So, usually most of these fellowships ask for a CV and 2 letters of recommendation. You can read this interesting article in IJDWL about the prospects and challenges of an Indian dermatologist working in the UK. Now, coming to Canada. Well, Canada is sort of like the place we go when, we don't get into USA. So, yeah, and the same is true for fellowships as well. It's much, much easier to get a fellowship in Canada. You can apply through the University of British Columbia, and they offer a variety of wonderful fellowships. Southeast Asia, on the other hand, is booming, especially for the cosmetic university. You have short-term fellowships offered by the Ramati Bodhi Hospital, which are there every month, which means you have a lot more opportunities to go there, and they only require you to have a communicative level of English. So the only thing is you must remember to apply for them 3 months before you go there. If you wanted a longer fellowship, you can apply to the Siriraj Hospital, which offers it for a duration of 1 year. However, you must have a working knowledge of Thai. Again, you may contact the director, and they may have something flexible for you that might work. So there are a number of shorter fellowships, especially useful for those who are currently working and they cannot afford going away for a month or for a year. But I personally would suggest that any fellowship or observership for less than 2 weeks may not be that useful for you. So there are a few fellowships that are available throughout the world and are offered by the ISHRS. And you need to look at the requirements of the each individual country that is required. So coming to India, well, India is always our home, and we have a lot of ample opportunities over here. The IIDVL also offers fellowships, and they offer a stipend for less than 35 years of age, although older people can also apply without the stipend. You can check out the website and find the list of centers that offer them. Also, I would suggest going through each of them and see what the program actually offers, whether they actually offer any hands-on training or not. So that is actually mentioned in their submission requirements before they get this grant. The AXI also offers fellowships. It's for 4 weeks for those who are less than 45, and they offer 2 weeks fellowship for more than 45 years of age. You have to be a life member of AXI, and the selection is based on your CV. There are a number of accredited fellowships. For example, RGUHS accredited fellowships are available in QTIS in these 4 subjects. Also, it's available in Venkat Sarmalia. Venkat Sarmalia also offers you a shorter fellowship program also if you're interested. And the Bangalore Medical College also offers fellowship in these 4 subjects. There are fellowship options available in each state. All you have to do is go and check the university website of the state, and they would have listed which fellowship is available in that state. So what is the best time to do a fellowship? Well, it is again depending on you. If you have all the resources, I would say go and do it as soon as you can. But if at all you don't have it all together, develop yourself and eventually do a fellowship, because it's never too late to do a fellowship, and your experience will actually aid you. Coming to travel grants, these are actually much more easier to get, and you get to attend their conference and you get to present your paper. There are a number of organizations. For example, Strauss and Katz Award is given by the AAD. The Women's Dermatologic Society also provides grants. The Imrit Sarkani is available with the EADB, and the British Association of Dermatologists, and the Marion Durant Scholarship by the ISD. The New Zealand Dermatologic Society also provides travel grant, and it's also available in the ISPD. So IADVL also offers a travel grant. You get 15,000 national scholarship for attending in India, and 50,000 for international conferences. So one member is allowed only one of these conferences in their lifetime. So remember to choose wisely which you apply for. And also the Cosmetic Dermatologic Society of India also offers these grants, but you must be a member of their society. So a parting remark: a tall building stands on a strong base, and a traditional dermatology will always help you. For example, like Ankur sir said, you don't want to be referring tinea cases just because you're doing cosmetic dermatology. Thank you so much. And I hope each of you take on to mentoring just like my mentor has guided me. Thank you.
Thank you so much, Dr. Vignesh. I would request Dr. Dinesh sir to please felicitate Dr. Vignesh.